नमस्कार। नीता भसीन शो में आपका एक बार फिर स्वागत है। आप जानते हैं कि हार्ट अटैक्स और हार्ट डिसीजेस सबसे ज़्यादा साउथ एशियंस और साउथ एशियन डिसेंट्स में हैं। चलिए, क्या कारण है इसके, जानते हैं डॉक्टर राजीव जौहर से।
Neeta ji, thank you so much. It's a pleasure to be on your show. Northwell Health is 23 hospitals in on Long Island, in Manhattan, in Staten Island, and up in Westchester. We have seen in this pandemic over 14 to 15,000 patients with COVID positive. That's probably the most, definitely the most in the U.S. and probably one of the most in the world. It's not a record we want to have, but we were right in the epicenter, and we started dealing with these patients really in early March. And we hit our peak on April the 7th, and thankfully now we're coming down and things are getting better. What's most important for me, as this is being broadcast to a lot of the South Asian population, is people have to realize that there are certain risk factors that people have that are dangerous, that increase your chance of symptoms. We know that people who are obese, who have hypertension or risk factors, are at higher risk of having symptoms. Because we know that 80+% of patients will never have a symptom. They may have been exposed to COVID, but they will never have a symptom. It's the few percent, 15 to 20%, that develop symptoms. Then the very, very few who get very, very sick, can't breathe, get really bad pneumonitis and pneumonia, and some who unfortunately pass away.
डॉक्टर जौहर, आप साउथ एशियन कम्युनिटी को काफ़ी रिसर्च की है आपने, और आपने मेरे साथ ये रिसर्च शेयर भी की थी। और जब मैंने आपको बोला कि मेरे हार्ट प्रॉब्लम्स के चांसेस बहुत कम हैं क्योंकि मैं वेजिटेरियन हूँ, मैं मीट नहीं खाती, और आपने मुझे एक ग्राफ दिखाया, मैटर ऑफ फैक्ट प्रेजेंटेशन दिखाई, जिसमें गुलाब जामुन और समोसे वगैरह थे। तो उसके बारे में बताएंगे?
Of course, 60% of all the heart disease in the world, 60, is our people.
आप कह रहे हैं 60% जो हार्ट प्रॉब्लम्स हो रही है वो साउथ एशियंस में हो रही है?
हाँ जी, immigrants, whether वो रहते हैं अमेरिका में रहते हैं, whether they're in India, Pakistan, borders have no effect. If you have if you are of South Asian descent, 6 out of 10 of the people in the world who have heart disease will be our people.
Why?
That is crazy.
Why?
They say that. Why? Because a lot of factors. Genetics plays a huge role. We have a huge diabetic community. In Queens, we have a zip code called Richmond Hills, which is in Queens, which has 25% of the people who live in Richmond Hills have diabetes. 25, the biggest zip code in the country for diabetes. With diabetes, you have increased risk of heart disease. And I tell everybody that in life, you have things that are modifiable and things that are not modifiable. So you can modify your diet, your exercise, your salt intake, but you can't modify your genes, where you were born, your risk factors. If your dad mom have diabetes, your chance of having diabetes is very high. You can modify your sedentary lifestyle. So if baag nahi rahe, exercise nahi kar rahe, that's a problem. And so what I tell everybody is that if you look at the same Caucasian person, same height, same weight, your risk of having a heart disease is much higher. And therefore, you have to treat yourself in a more controlled fashion. You have to watch your diet, you have to exercise. And also, we see that people who develop symptoms of COVID are the ones who have the risk factors. So if you're fat, if you're hypertensive, if you're diabetic, if you have heart disease, if you have poor lung function, if you don't exercise, these are people who do the worst. So this is why I'm talking to you today, because it's important for our people to know that just because you are locked down in your house does not mean you have freedom to do everything you want. जब आप vegetarian होते हो, then आप तला हुआ खाना खाते हो, you eat the fried foods, you're more prone to eating foods that are not as good for you. So I call this contaminated vegetarian. So you'll eat the samosas because you say, well, I'm a vegetarian. Or you'll eat the fried fritters because you say, I'm vegetarian. Well, that is as bad as eating meat. And the problem is the Indian diet is much different than the American diet. We are carbohydrate based. The American diet is more protein based. So the American diet is usually about 50% protein, 25% carbohydrate, 25% fat. We are 50 to 60% carbohydrate, 25% fat, and the rest protein. And we all know that protein is much better for you than a carbohydrate base that can change to fat.
One more question, Dr. Johar. अब जो COVID-19 की वजह से are you giving a different medicine to the patients अब या कुछ चेंज किया है आपने मेडिकेशन देने में अपने रेगुलर पेशेंट्स को जिनको हार्ट प्रॉब्लम्स हैं?
The heart medicines are exactly the same. You may have heard some stories about certain blood pressure medicines. That's not true. I do not use hydroxychloroquine, the one they in India they use for malaria and other things. I don't use that because there's no data to support its use, and the risk outweighs the benefit. We are sending people home on high dose blood thinners for at least 3 months after they leave the hospital.
Thank you so much, Dr. Johar, for your time.